I'm going to get you to go ahead and bend this knee for me, please. So in order to correct an outflare, we're going to do the same type of technique. We're just going to get our patient to push in a different direction. Okay? So with this, first things first, because she has an outflare in the hip, we're going to be trying to bring things inwards, right? First thing you want to ask your patient, do you feel any pinching on the inside of the hip, or is this okay? Okay, good. What do you do if they feel pinching on the inside of the hip? Release, but we got to get those tissues out of the way. So a circumduction motion, either inwards or outwards, will rearrange the tissues, and that's probably going to make it worse, actually. Let's go this way. So just move the leg around to literally shuffle the tissues around a little bit, and that often gets rid of that pinchy feeling. Okay? Still doing okay? Good, okay. So you want to make sure that, okay, so normally with just an outflare, we would just be going straight over, right? But she had a rotational component to her dysfunction, right? She had an anterior rotation, and often the foot will want to drift forward. That will provoke the recurrence of that anterior rotation. So because she has an anterior rotation, yes, I'm going to be posting generally straight over, but I'm going to come at it with a superior diagonal force to try and counter that rotation that we just tried to correct. Does that make sense? No? Okay. So your hip was rotated forward, right? When we do this correction, naturally your foot is going to want to drift, which will let your hip slip downwards. We don't want that. We just try to correct that, right? So instead of pushing straight over, letting your foot slip, I'm going to push straight over, but with an upwardness to try and keep your hip backwards. Make sense? Okay. Anybody else unclear about that?
So her right leg is longer and was longer, and then you're trying to
maintain that. Yeah, maintain that while still correcting her outfit.
Gotcha.
All right. So just like with the other correction, we want to make sure that we actually bring this as far as we can. Bring it to tissue restriction, resistance, whatever. Are we doing okay? Good. Actually,
So
your hips are coming too far off the table. Can I get you to center your hips for a second? Good. And then we're just going to try and into the hip. We don't want their low back to come off the table. It's right about there. Okay. So when I say so, I'm going to get you to go ahead and push into my hand this way. And we're going to hold that for 5 seconds. After 5 seconds, you're going to stop pushing, you're going to breathe in, and when you breathe out, I'm going to come diagonally over, and my hand is going to try and bring the hip over and in an upwards direction. Okay? We're going to do that push-hold scenario 2 or 3 times, and after we're done, we're going to get you in the middle, and we're going to reassess. Okay, do you have any questions about what we're going to do? Possibly have your permission to continue? Yes. Awesome. By the way, my consent sounds exactly like that in clinic.
It does. I was there the other day.
So first things first, tissue restriction. Now there's one thing to keep in mind. Yes, we can go straight over, but it would be more effective if you apply an axial distraction to try and separate that innominate bone posteriorly to create more space in that SI joint. Does that make sense? You guys can envision what that looks like if we push that innominate bone slightly posteriorly. It creates more space in that SI joint. Okay, have I lost anybody? Wonderful. Okay, so now let's actually do the correction that we've been trying to do for the last 10 minutes. All right, so go ahead and relax your hip pusher. Good. Nice and gentle. I'll get you to try and push in my hand. Hold for 5, 4, 3, 2, 1. Let go back in. And out. Good. Don't hold it. Let go the time. Good. Nice and gentle. Go ahead and push in my hand. Hold for 5, 4, 3, 2, 1. Let go back in. Let it go, let it go, let it go. Good, your stomach, let it go. Perfect. Okay, one more time. Go ahead and push in my head. 5, 4, 3, 2, 1. Let it go back in. And out. Let it go, let it go, let it go. Your stomach, let go. Good, breath in. And out. Perfect, good job. And then I will bring her leg back out, but I try and maintain that hip a little bit. Good. I will get you to the center and we'll see how we do. Good, let's lever bar step. It's a workout, y'all.